Today, join us in exploring diabetes and its complications and ways to reduce your risk. If you haven't seen our initial video on understanding and managing diabetes, please watch it first. Diabetes is a chronic disease that occurs either when the pancreas does not produce enough insulin or when the body cannot effectively use the insulin it produces, and that can lead to various complications if not properly managed. That's why it's important to know what you can do right now to help keep track of and reduce long-term problems.
First on the list, heart disease and stroke. Having type 2 diabetes could elevate your chances of experiencing heart disease and stroke. Adults with diabetes are twice as likely to have a heart attack or stroke than people without diabetes. Here's how you can lower the risk of heart disease or stroke. By collaborating with your care team to ensure your diabetes is well controlled, by consistently adopting a heart-friendly diet that restricts sodium and sugar, targeting a high heart rate with a minimum of 150 minutes per week during exercise, and most importantly, keeping a positive mindset can make all the difference. There are millions of people with diabetes leading healthy lives, and you can be one of them. Nerve damage. The body's nerves are like wires that send signals to and from your brain. Over time, high blood glucose can damage the nerves in your body, and this damage is called neuropathy. People who have had diabetes for a long time are more likely to have some nerve damage, and please pay attention to these symptoms. These symptoms may vary in intensity and might be more noticeable at times. However, they can also be linked to other health issues. Make sure to discuss any of these symptoms with diabetes care team if you or your loved one with diabetes is experiencing them. Here are some ways to help reduce the risk of nerve damage. Foot damage. Did you know that nerve damage can prevent someone from feeling pain, heat, or cold? That means that in the event of a sore or cut, there might be a lack of sensation, leading to potential neglect and untreated conditions. Consequently, it can get worse, leading to infection. And here are some tips for people with diabetes to protect their feet. Eye damage. Diabetes-related eye damage is often attributed to a condition called diabetic retinopathy. High blood glucose can damage the tiny vessels that bring blood to your eyes, and this could lead to loss of vision. And taking these steps may help to protect the eyes. Kidney damage. The kidneys hold millions of tiny blood vessel clusters that filter waste from the blood, and diabetes can damage this delicate filtering. This damage forces the kidneys to work too hard to filter blood, and after many years, the extra work can make the kidneys fail. Here's what you can do to care for your kidneys. Keep blood glucose and blood pressure in check, have a urine test for protein each year, have a blood test for serum creatinine, quit smoking. Teeth and gums damage. One area of the body that people don't often think about when it comes to diabetes is the mouth. Diabetes can cause oral health problems. That's because high blood glucose can add more sugar to saliva, which can help harmful bacteria to grow. Among the oral issues linked to diabetes, gum disease is particularly risky. Why? Because individuals with diabetes are more susceptible to bacterial infections. Once an infection occurs, it can be more challenging to treat in people with diabetes. You can protect your teeth and gums by regularly visiting your dentist for checkups and cleanings, and be sure to tell your dentist that you have diabetes. In conclusion, it's crucial for all of us to be vigilant about diabetes and its potential complications. By understanding the risks and taking proactive measures, we can work towards better management and prevention. Remember, early detection, healthy lifestyle choices, and regular monitoring are key to maintaining overall well-being. Feel free to share this information, and don't forget to tag your friends and loved ones. Thank you for watching from Minneapolis Health Clinic.